Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Well, hello, everybody, and welcome back. Today we have with us Dr. Peter Baum, who is going to introduce himself in a moment. He's a fellow coach and also working in the space of negotiation, which I'm excited to hear all about. So welcome, Peter. I'll let you introduce yourself.
Yeah, thank you so much for having me. It's a pleasure to be here. My name is Dr. Peter Baum, and I am a family medicine physician. I also work clinically as a clinic medical director at a rural federally qualified health center. I've been doing that for a number of years now. And I've also been a physician coach now for about 4 years, helping other physicians work through, navigate, overcome burnout, prevent it from getting worse if they're going through it. And then have in the last year started a joint venture with another physician coach, a company called Doctor Contract Negotiation LLC. And we're at physiciancontractnegotiation.com, and we're on a mission to really change the physician contract landscape and empower physicians, especially early career physicians, to come out of their training and really advocate for their worth and their value, because it's just something that's not taught to people. And so we're working to try to change that. So
Yeah, I like this. This is good because as a non-US physician, it's going to be interesting to learn a little bit more about the back end of that. But first of all, tell us about you and your career and how it all went down and how you got into this space.
yeah, that's a good question. So I was one of those people, I knew from a very young age that I wanted to go into medicine from the time I was about 8 years old. Took a little hiatus and did teaching for a while before deciding to come back into medicine. And then I always knew that I wanted to go into a primary care field. And just family medicine was my passion, for continuity of care, developing those long-lasting relationships, being able to see the whole family, and just really working to empower people from a community health and preventive standpoint to be at their healthiest they can. And obviously, when you know acute illnesses come up, treat people. And so, yeah, I finished training. I went to medical school in California, and I'm a DO. I'm a doctor of osteopathic medicine.
Hmm.
Did a residency in Southern California and have been practicing here now in Southern California for the last 7 or 8 years. So, um,
Okay. Okay.
yeah, early on in my career, I experienced burnout,
Okay.
and it was with the help of a coach that I learned to sort of shift my mindset and overcome it. And that's when I
Okay.
decided to become a coach myself to help empower others to do exactly the same.
Got it. So tell us then about that journey into burnout. What did that look like for you? How did it present?
Yeah, that's a really good question. Actually, for me, I've always been one of those people where I give everything my 150%. Right? It's like so many of us as physicians, we're just dedicated. I used to have perfectionistic tendencies, and I'm learning to let those go, right? And in residency, I just remember working exuberant numbers of hours, late nights, giving people the best care possible, but then really just finding myself not loving what I was doing at that point. Probably there
Mhm.
was a combination of some lack of sleep, et cetera, in there just from working so hard. And I had overcome that. But then early on, maybe, another year or two in to actual, finish after I'd finished residency, started kind of feeling similar symptoms where I just wasn't loving going to work. I wasn't enjoying it, and it wasn't everything I thought it would be, right? And
Mhm.
at that point, I really struggled with charting. That was one of the
Mhm.
biggest things, right? And it was one of those things, making the chart perfect, right? Like getting the narrative great, right? Making it so that it was capturing the entire history and plan. Um, and it was a lot of mindset shifting to sort of learn how to manage my own mind about it and
Mhm.
overcome that. And I used to have a lot of, I think, narratives that were just unhelpful up in my mind about I couldn't get faster. The system was the way it was. I couldn't change it, right? And it was once I started working with a coach that I was empowered to think, oh my gosh, I can actually change and shift how I'm thinking about these circumstances here that I'm going through and regain that agency, and take control of my time.
Yeah,
It's a
yeah.
slow process. I mean, it takes time. It's not overnight, but it's been a shift. So
Yeah, what was that like in terms of going in your day to day when you're seeing patients and the notes weren't done? When were you doing them and how what else was happening in the day?
yeah, that's a good question. So I mean, I've always worked in federally qualified health centers, so it's always patients who, are sort of like lower socioeconomic status and have a lot of social things
Hmm.
going on that affect obviously their health and their ability to make appointments, things like that. And so I think early on in my career, I was one of those types of physicians where I would try to address just every single issue that would come up, right? That I could because I knew that the patients oftentimes even were traveling, from far away to come to the clinic. But it was at my own expense, right? My own self-sacrificing expense. And so I remember not running on time, being late consistently, right? I kind of charted a little bit as I went, but not fully, right? And then there was always like that thought in the back of the mind that's, oh, I got to see the next patient, right? I
Hmm.
don't want to be late, right? And that plus being sort of having interruptions throughout the day if medical assistants would be coming in for other issues that were coming in for other patients and not really having a adequate sort of workflow on how to address those things and whatnot. I think the combination of all those things just really led me to staying late at night, charting a bunch and being not very happy with things. So
Mm.
yeah, I think that's
Would
kind
you just stay on and on and on after the patients left? Were you just staying
oh
till it
yeah.
was done? Okay, okay.
Oh
So what
yeah.
time were you kind of out of there in the
Oh my
evening?
gosh. It was in the early days, right after residency, probably I'd be there till 7, 8, sometimes even 9 o'clock at night charting, right? Before
Okay.
going home. And that was just miserable because I was sacrificing all that time I could have had with family.
Yeah. Tell us about, is anyone else there at that time or was it just you there?
The janitors.
The janitors were there, but no one else. Okay.
Sometimes me by myself after the janitors had already left, but that was
The janitors have already left. Okay.
yeah,
Yeah.
I'd be the one to put
Yeah.
the alarm on.
Yes. Okay. Now tell me more about who noticed. What were they saying to you about, hey, why are you here so late? Or was there any kind of feedback about that?
Zero, none, right?
No one
Nobody,
cared.
nobody cared, nobody knew. It was me suffering in my own sort of self-sacrificing misery. Um,
Okay, okay, got it. So you see
yeah,
patients all day. It takes you at least that's 3 hours after the last patient to get the charts wrapped up.
yep.
Was that also inbox or was that just the charts?
Charts and inbox, everything,
Everything. Okay, all right.
everything.
And then who's at home at that point in your life?
At that point, that was back in 2018, 2019. I had just had my first daughter.
Hmm.
With my wife, and at that time she was born in the fall of 2018, and um, so yeah, it was my wife, daughter, and I at home.
Wow. Okay, so we got little person at home, and you're there till 8 o'clock at night. That stinks.
Yes, absolutely,
That stinks.
absolutely.
What's wife have to say about all this?
Oh, she was not happy with it either. It's just
Yeah.
I just felt stuck. I felt like, oh my gosh, what can I do to change this? And I felt so powerless at the time because I just didn't
Yeah.
really have the it was the mindset first that just wasn't there to help me shift,
Yeah.
right?
Yeah. Yeah.
It was me shifting from I'm not efficient, I can't do this fast enough, the system is just you know gonna bring me down kind of a thing to okay, I can develop
Yeah.
workflows and I
Okay, but before
am
we get there, wait a
developing
minute,
them.
wait a minute. I'm stuck. The
Yeah,
system's going to bring me down. I think a lot of people can identify with this, right? Because this
totally.
is miserable. Like I
Yep,
can I can feel the miserableness of
yep.
8 o'clock at night. You finally get done with these stinker charts. And you mentioned something earlier. You said I was a perfectionist. I needed everything in that chart. Okay.
Yep.
And you kind of said, and I overcome it, but that's a very like short statement to get over perfectionism. Like this is someone who is like dedicated. Was there anything else about the what's in the chart that you were concentrating on? Like this is the importance of it. Why was it so important to get everything in the chart? What do you think if we were to pull you back to that moment? What is so important about getting everything in the chart that we're letting little baby and wife kind of miserably suffer at home? You're miserably suffering at the office. Like everybody's miserable right now.
Yep.
Nobody's having a good time.
Nobody. Um, I think that, you know, for me, yeah, the mindset, just that narrative, right? Making it perfect. Like I think there was imposter syndrome that was really at root
Okay.
with a lot of
Okay.
it. Sort of being in that mindset of a resident still, sort of feeling like I had to like kind of almost like prove myself through my notes,
Yeah.
right? Like there was some
Yeah.
self-value tied to the charting somehow.
Yeah.
And I
Yeah.
think it took a lot of mindset shifting to kind of like realize and separate, okay, my note is not a reflection of me necessarily as a physician, right? I'm an excellent physician as I am. It took me a long time to kind of get away from that, thinking that there was some sort of like value related to me as a physician and my note, right?
Yeah.
And I
Yeah.
find that actually working with because I actually work with clients too on charting, and that's such
Yeah.
an early career, right? That's an early sort of like career mindset a lot of doctors have when they come out of residency because of kind of I think how medical school and residency is,
Yeah. Yeah.
right?
Well, you can understand it because you're valued on your performance based on what your precept is reading in the file.
Yep,
And you're also being told, don't chart like that, chart like this, because that's how I do, and I want you to do it my way. While you're under each person's directive, like you can understand why you come out freaking confused about this whole thing. Because
100%.
what you write down is what you're going to be evaluated on in residency, and how you do it and the volume you put in there is going to be praised.
Exactly.
If you're
Yeah.
doing it the way they want, they're like, oh, star pupil, you're doing a good
Yeah.
job. It
Yeah, right.
creates this narrative of I must. Yeah.
Yeah.
Okay. Now, how on earth did coaching fall in your lap? Like, was it, where did you see this? What was going on that coaching seemed to be a good idea to help you?
Yeah, that's a really good question. I'm glad you asked it. And here's my moment of vulnerability, and I think that we need more vulnerability as physicians, right? Um, I had some mental health struggles where, I'd gotten support, medically and professionally through therapy, et cetera. And it just wasn't really helping, right?
Mm,
It was
okay.
it was good to have validation of what I was going through, but it wasn't helping me to shift my mindset.
Okay.
And I was on an email list for, another physician, entrepreneur, blogger out there who, um, Jimmy Turner at the time. Um, and he had launched a coaching program, and he was, as far as I knew, one of the first male physicians in the coaching space.
Hmm. Hmm.
Um, and I thought to myself, what do I have to lose here, right? I've already gone through all this other medical and professional, therapy, psychological support for, going through what I was going through because I had a couple of different life circumstances that had come up. Um,
Mm.
and so for me, yeah, I just thought to myself, okay, I've got nothing to lose here. I'm gonna give this a try. And I remember just going through the program and thinking, oh my gosh, like never has anybody ever challenged sort of like my thought process and helped me to sort of flip those scripts on their head
Hmm. Hmm.
to start thinking differently. Um, so that yeah, it came to in my email inbox. That's how I that's how I landed on coaching.
Um, so we had the email come in from Jimmy, and something about that headline uh, captures your attention. And you're like, I'm going to give this a go. And I'm going to allow somebody else to start to poke and prod at the way I do my day. which is an interesting and fascinating thing. I guess you're used to it a little bit because you've had the therapy and you've had the interventions a little bit. So you've already been exploring, doing a little bit of internal investigation. But now we've got a peer who is kind of pushing your buttons and questioning how and why you do things. And you're like all in.
Yeah.
Was it
Yeah.
an easy process to change? Because you said, you've spent this is 3 hours every or most clinical days trying to get your day done. And
Yes.
they're saying, why do you do it that way, Pete? Why do you do it that way?
Yeah.
Tell
Yeah.
tell us some of those early kind of aha moments that might have started to shift you a little bit.
Yeah. I remember actually going through a coaching session, and I think my unconscious sort of thought process and what I call a limiting belief had come up was, I think it was I'm not efficient and I just can't get faster.
Mm,
And he asked me the question, he said, "Do you want to continue to believe that?" And I said, "Wait, what do you mean? Do I want to continue to believe that?" Because it was a choice, right? And at that time, I didn't view it as a choice,
mm,
right? And so as soon as he asked me that question, it was like, holy cow, wait a minute, I can actually choose to think something different if I really want to, right? Because the fact was, I used to make it mean in my head, right? That when I was getting home at 8 or 9 at night, I used to make it mean all these things about me also as like a husband and a father, and that I wasn't a good husband,
mm,
wasn't a good
mm,
father, right?
mm,
And I should be getting home earlier, right? All of just this like self-shaming stuff going on.
mm. Yeah.
And he's like, do you really want to continue to believe those thoughts, right? Like if you were to say it to a colleague or a friend, like if your a colleague came to you and said, "Hey, I'm struggling with charting. I'm here till 8 o'clock every night." And he said, "What would you tell that friend or colleague?" And I came up with some answer, right? And clearly it was something compassionate, empathetic, right? And
Mm-hmm.
something like empowering.
Mm-hmm.
Like you can do it. Right? It's going to take time. You can figure this out, right?
Mm-hmm.
And I remember him saying, you had this chance to start thinking and talking to yourself like that, just like you would talk to your colleagues and friends who are going through the same thing, right? And so you get to shift that if you want to. And I said, wow, I had no idea, at that time. I guess I didn't realize that there was that agency like there
Mm.
inside, right? When I was just struggling so deeply with the charting at that time.
Yeah. Well, you're not wrong. It feels like inefficient. It feels like I just need to go faster. It feels like I just need to be able to do more in less time. Like there's a lot of that pressure
Yeah,
is that autopilot response to the system. If
100%.
I've got to double the patients tomorrow, I've just got to somehow magic that in because we've got to have our 15 minutes for everybody or whatever that looks like. And then suddenly you're confronted with, you want to keep thinking in that way. And you're like, what?
Hmm.
There's some options here.
Yeah,
What were some
exactly.
of the early changes that you saw?
Um, I think that one of the things that really just helped me to shift my mindset the most was I wrote it on a post-it note, something along the lines of I'm learning to become more efficient, right? Or I'm developing workflows, right? That was
Mm-hmm.
like sort of like my mantra. I'm developing more efficient workflows.
There you go.
Um, and I posted it on my computer monitor, and
Yeah.
every time that I was charting between patients or through the day or a little bit after hours, I just kept on repeating that in my mind, right? And that led me to really start asking myself, okay, what can I do to make this process just more efficient, right?
Yeah.
How can I make this process more efficient? And I think that just led to this continual self sort of introspection and yeah, discovery really of like this internal power that was there to really like take command and control of the day, right? That I didn't previously know was there.
Yeah.
Um,
Yeah.
so it was mostly that, and then developing obviously templates that were helping me to chart efficiently, doing
Mm-hmm.
pre-charting,
Mm-hmm.
um, kind of loading up prior notes or loading up
Hmm.
the physical exam template, loading up prior assessment and plans, maybe changing them, putting in orders ahead of time, and
Yeah.
all eventually sort of I've developed that over time. Um, yeah, and so
So
now I
what
get
is
home.
your day?
Now I
Yeah,
get
the
home.
day now.
I mean, so I still do stay a little bit late sometimes, but like 30, 30 minutes and finish, and then I'm gone, and then my
Yeah.
inbox is completely cleaned out, notes are all done for the day,
Yeah.
and I'm home at a much more reasonable hour. So,
Okay, but but the person is still stuck back in that, but you don't understand these patients have no money, they've traveled 3 hours to get to see me, they've got all these social issues, I'm the only one who can help them. Like when you're stuck back there, like how did that reconcile to now? Like what is different about the way you interact with patients? Have you had to do any compromises with care?
I think it's a really good question, right? I mean, I think what is good care, right? Who's the one to determine that, right? And there's no universal like right or wrong answer. And so I think it's comes down to being willing and able to set healthy boundaries, right?
Mm-hmm.
So that when, there's that sort of last minute, oh, by the way, doc, can you help me with this? My knee's really been bothering me for, and it's
Mm-hmm.
hurting a lot right now. And I'm like halfway out the halfway out the door, right? I used to sort of give in to that urge, right? To like want to sort of people please and want to help the
Yeah.
patient.
Yeah.
But learning how to just really do strong agenda setting right from the beginning,
Mm-hmm.
um, right at the very start of the visit, setting a strong sort of expectation around time with the patients,
Mm-hmm.
right? Letting them know how long the visits are, right? Hey, we've got a 20-minute visit scheduled today. How can I help you? Right?
Mm-hmm. Mm-hmm.
Like that phrase, how can I help you or what can I do for you? Like
Mm-hmm.
ch game changing, right? I remember in medical school they taught us what brings you in today. And
Mm-hmm.
now when I work with people as other doctors on charting and helping them develop more efficient workflows, I say trash that
That's
statement.
right. Trash that because you don't
Never,
want to hear about the car ride. That's right.
you
Yeah.
don't want to hear about the
Now we're going
cats at home.
beeline to the big juice. That's right.
Yeah. So just that really strong agenda setting
Yeah.
early on in the visit is what makes a huge difference among so many other factors. But
Yeah. Yeah.
and when patients do bring up concerns toward the end of the visit, making sure that I'm, acknowledging and
Mm-hmm.
validating, what their concerns are.
Yeah.
Um, I love like I like to say, gosh, it sounds like this is really, concerning to you, and I'm concerned about it too. I
Mm-hmm.
usually ask some sort of question about the urgency, of it and say, oh,
Mm-hmm.
so what made you bring it up today? Right? Like, how come
Mm-hmm.
this has been going on for 9 months, but what made you bring it up today? Right. And then
Mm-hmm.
that question, right, kind of helps to gauge whether or not it's truly urgent or not.
Yeah.
Right. And then kind of shifting into, okay, it sounds like this is not urgent.
Yeah.
I want to bring you back.
Mm-hmm.
Give this the time it deserves, sort of reframing it for the patient but providing validation and saying, it sounds really important. Let's bring you back as soon as we can and address that and help you get to the point.
Mm.
So I think that's a big, huge shift that for me took a while to just sort of develop, but
Yeah.
it's so important. So setting those boundaries.
Yeah. Yeah, so it sounds like there's still quality care going on for the patients. There's still the interest in the human with you in the room, and there's still the ability to address concerns, but just doing it in a different and new way. And I
Right.
think that's all important to kind of notice when you're at the beginning and you're like, but you don't understand.
Hmm.
These patients have no one. With the stories we say and tell ourselves about our patients can really drive some of the stuckness that we feel in that moment. So thank you. Now,
Absolutely.
I want to transition into this new venture that you're in because I'm also interested in this. And this is that negotiation for physicians, especially in the early career.
Yeah.
Because I think that the payment models that I've seen for that are typical perhaps for the US physicians And we see very different models across the world, of course. But just take us a run through what got you into this space and what you're noticing and what you want to achieve for people.
Yeah, so that's a really good question. I'm glad you asked. I think for me, I changed jobs a few times early on in my career, and that
Mhm.
was because um, I did something called the National Health Service Corps. I had a scholarship for part of my medical school, and
Mhm.
so therefore I had to sort of pay it back, if you will, by working in a high need area. And so my job sort of prospects were limited, right, in terms of like where I could go and work within a
Mhm.
certain geographical range, right? I remember I'm in San Diego currently. I did my training in San Diego, California as well. I remember at the time when I finished residency, there were only two clinics within the greater entire San Diego County where I could work.
Mhm.
At the time, my wife, she had been finishing her PhD in public health, health behavior
Mhm.
research, and she'd applied to a couple different postdoctoral fellowship programs, and we ended up moving up to Northern California for her to be able to attend a prestigious postdoctoral fellowship. And so I ended up changing jobs a few times early on, right? I was at my first job at a rural
Mhm.
clinic at a federally qualified health center, working with Native American populations. Um, Moved up to Northern California. My wife and I, it was right in the middle of the pandemic, didn't love it up in Northern California. We had no network, no friends, no sort of
Mhm.
like social anything at that point early in the pandemic. And we're like, man, we got to get back to San Diego whenever we can. And so we moved back, right? And so I think I changed jobs a few times, right? And in that process, learned to negotiate and advocate for my
Mhm.
own sort of value,
Mhm.
just because I don't want to say forced to, but by the changing circumstances of needing to change jobs, learned how to navigate that process and negotiate. I did have help from like a mentor early on,
Mhm.
um, but then what ended up happening was in my own residency program that I graduated from, people had come to me, started asking me these questions like, hey, like, can we heard you helped, so and so. Can you help us? Can you help me too? And I said, sure. Sounds good, right? And so I loved it because it was something that just nobody receives training on when they're in residency.
Mhm.
And a lot of people just kind of come out and think, okay, this is what the offer is. I can take it or leave it, and that's it.
Yeah.
And what they don't know is that, negotiation is expected, right? I mean, this is at the end of the day, like it's also medicine. I don't like to say it, but it's also a business, right? Especially in the United States, right? Like, um, and so I ended up just helping a number of people who had come through my own program and really loved doing that. And I had this idea in my mind literally for like 3 years. I'm like, I'm gonna eventually start this
Mhm.
program where we create an online course and then do group coaching and help people in their early career physician, tracks to come out and really feel like they've got the confidence to navigate the process
Mhm.
and get their worth, right? And um, through some other physician entrepreneurial groups that I'm part of, I met someone else who had the same sort of ideas
Mhm.
and vision. And I thought to myself, if you want to go fast, go alone. If you want to go far, go together.
Mhm.
Um, and I said to this, her name is she's Dr. Cynthia Chen Joya. Um, I said to her that exact phrase, and I said, why don't we work together instead of competing with one
Mhm.
another, right? Let's do
Mhm.
this. Let's just take this off and empower as many early career docs to, really navigate this process with confidence and get their worth, right? Because otherwise we get these lowball sort of offers, and if we don't know, we just accept them, right? I remember in my first contract when I was coming out of residency, obviously I had some help from a mentor, and it was so valuable, but I just remember seeing like the starting salary, and it was a solid 25,000 less than the other sort of offers I had been seeing in the area. And um, early on I had this like thought process, like I can't really negotiate this, or like this is just what the
Hmm.
offer is, right? I don't want to come across as rude. I don't want to come across as
Hmm.
greedy or something like that. Uh, but with sort of sticking to my mindset of, okay, I'm gonna ask for
Hmm.
I believe my value is, right? Was able to successfully negotiate, that early first job salary up by 25,000 per year, which is a huge, difference when you've got
Hmm.
loans to pay, a family you're starting, you're trying to buy a house, like that makes a huge
Hmm.
difference for your overall sort of career trajectory, right? And um
Yeah.
yeah, so when Cynthia and I started the program last fall, we sort of just hit the ground running, and it's still growing, right? It's early. And so
Hmm.
getting our name out there and seeing who we can help and how we can help early career
What
docs.
about the other parts? So there's salary, but then there's what is the requirements on you to get that salary? So, for instance, number of patients seen, or the other, is there wiggle room there as well?
I think it really depends on the contracts that
Hmm.
people have. I mean, nowadays, I want to say the latest statistic that I heard is somewhere between, I want to say, like 60 to 80% of docs in the US are now employed, right?
Yes, yes,
Um, And that number has been changing very fast, like from in the last 5 years. It used to be like 50
yes,
something percent. And in the last year, I think I saw like 60 or 70% in the last
yeah,
couple of weeks.
yeah, yeah,
Um, and so, obviously there's straight salary, there's, a base salary with RVU production bonuses, et cetera,
yes,
right? There's quality
yes,
incentives that people get
yes,
paid depending on what sort of system they're working in.
yeah.
There's CME
And
fund.
quality incentives, for those who aren't aware of those, is like if your patients have had their HbA1cs and they've had their feet checks and they've had their immunizations, and that's kind of is that what you mean by the health incentives?
So
Or they've
so
had their health checks, like their annual health exams, or a bit of both, a bit of everything really is what I've seen.
Well, I think it depends on like the clinic system and the model that
Hmm.
someone is working in, right? There's the most common thing that I'm seeing these days is that people just have a straight salary and they're expected to
Hmm.
see X number of patients
Hmm.
and expected to finish their charts within a certain amount of time. It's in the
Hmm.
contract, right? Tells them how many CME days or hours they get per year,
Hmm.
whatever the
Yeah.
CME dollar values are. And there's other contracts where people get a, sort of like a base salary RVU bonus on
Hmm.
top of that base salary. Those are the two main ones. And sort of production. I don't like the word product or productivity in medicine because people are not products, but
Okay,
um
tell me about
those
what you're noticing with inbox work. So, um, are you seeing a number of physicians getting paid to do those My Chart messages, to make phone calls, or is it now more video only telehealth that people are getting recognized as real appointments for their RVUs? What are the sorts of things that you're seeing in that spectrum?
Yeah, I think more commonly I'm seeing that doctors are just getting straight salary and not necessarily like all that extra work isn't necessarily being paid for and accounted
Or
for in the
acknowledged?
contract.
Yeah, yeah.
Yeah. Um,
Okay.
for people who are in more of that like RVU uh
Mm-hmm.
world of payment, somewhat, yes, that's there. Um, Partnerships are and private practice are a completely different, you know,
Mm-hmm.
completely different set of, sort of payment model than salary and the RVU production
Mm-hmm.
way of
Yeah,
being.
it really changes that what you were going back to that workflow efficiency and how you set up your day. When I'm working with physicians and clinicians, I'm looking at their pay model to help me figure out how they're going to set up their day to be most efficiently using what they're being given to help the patients in front of them. Because, like you said earlier in your career, you would stay those extra 3 hours, but you've earned all that money during the day. Like your salary isn't going up because you're spending 3 extra hours every evening doing all of that work. The
Yeah.
salary stays the same. How many hours you take to do it versus I get paid per hour, but how many hours do I want to work in the day? 18? No, thank you.
Right, right.
Right.
Yeah.
And so it's this ebbing and flowing as we're pivoting around payment models is so very important. And you can feel like you have no control. It's like, well, I've got all these my chart messages and I just have to answer them. And
Hmm.
even that is up for negotiation. Even that is there's wiggle room there
Right. Yeah.
with how you show up to do what is, just part of my day if you don't
Yeah.
think it.
Yeah. I think that one of the more common things I see a lot of, especially early career docs doing is spending that time after hours doing inbox management and sending messages, to patients that are could really warrant an entire visit for the level of complexity. Um,
Absolutely.
right? The level of complexity that sometimes people are going into in their responses and, the nature of certain questions that patients are asking really warrant an entire visit, right?
Hmm.
But there's this culture, I think, within medicine, right, to help the patients, and the patients come first, right? And we're all empathetic, humanitarian driven sort of people going into medicine, right? So we want to help patients, but uh, yeah, I think that sort of that training mindset in medical school and residency of just giving, 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 and doing all to give our best.
Hmm.
People just don't realize that, okay, I've got to set these boundaries for myself, and I'm gonna
Or I've got to
instead
be
of
acknowledged for that work, which is what you could
yeah,
potentially do in the world is say, listen, if you want to show up like that, go get paid for it. Go get paid
yeah,
well for it. Rather than just accepting that it's going to be um, an additional, yes, I'm saying yes to an additional hour of work here.
yeah,
It's that ability to step back. And I like the fact that you're in this space and you're able to start to push back against that system that says, do more, do more, do more. And you either say, okay, then acknowledge the work,
mhm,
or, and because you've got the training to do this now, do you really want to do that work?
right,
Right, which is the coaching piece. Like, what do you want to actually say yes to and go negotiate for it?
yeah,
Well, what else could this look like for you that's sustainable?
yeah. I
Which is
think
where
that
my work in the world is.
right, the one thing that, at least in my perspective, and probably many people agree, like the one thing we never get back in life is time,
Absolutely.
right?
Yeah.
And so the question is, okay, how do I want to spend my time? And how can I shape my clinical day and my contracts to help support, you know,
Hmm.
me spending the time that I want to be and how I want to be spending it, right? And so if someone's spending hours in the evenings, right, doing excellent patient care and spending uncompensated time for it, then if we want to shift that, that comes right from in here, right? We as the doctors need to advocate for ourselves, and if we don't do it, nobody else will,
Hmm.
right? And so like that's why that especially those early career contracts are so important, because if we don't start that process from the beginning, right, we might get into a job and not recognize that it might be a recipe for burnout and not a sustainable
Hmm.
career in medicine, simply
Hmm.
because of what is written into the contract in terms of the expectations and people's drive to not necessarily like set the boundaries that they need to be setting for themselves. So
Yeah. What about things like burnout? We know that only having 10 days off a year is not going to be sustainable in terms of burnout prevention and looking after yourself and unpaid mat leaves, unpaid paternity leaves. Like we see such huge discrepancies in the way those are treated around the world for physicians and clinicians.
right.
Are you starting to think about that in your negotiations?
Oh yeah, I thought about that early on, because I remember for my daughter, when I specifically like paternity and maternity leave, right? This here in the United States, right? The laws regarding sort of parental leave vary widely from state to state. In California, thankfully, where I'm located, right, there's pretty strong laws now and support systems financially to protect people's time to be able to do things
Hmm.
like take paternity and maternity leave. But I remember from I have two children. My daughter is 6.5, my son is 2.5. And when my daughter was born, I had just started my first job out of residency, but I hadn't been there for a year, so I wasn't
Mm.
entitled to the protected time of paternity or maternity
Hmm.
leave. I didn't even really think at that time to even ask about it in the contract negotiations and subsequent jobs, right? That was
Mm.
something that I made sure, okay, wait a minute, I only took 2 weeks off when my daughter was born, and the in the future, right? I thought to myself, okay, when I have another child with my wife, right? Like we got to set ourselves up for success so I can be supportive at home, right, to help
Hmm.
welcome our next child
Hmm.
in the world. And thankfully, for my son Teo, who was born back in 2022, I took 3 months off,
Mm.
and I was there as a dad. I was there as a husband, right? And um, but taking that into account before even like accepting my job that I'm at currently, right? So we're taking that into account early on. In the onboarding process and negotiation process was important, right? And so we can plan for these things. It just if you don't know about them, then it's hard to
Mm.
plan for them, right? And so a lot of early career docs, that's where they benefit from the mentorship and
Yeah,
coaching.
yeah. What about things like gender and pay? Are you seeing much differences in what people are getting offered based on gender um, at the moment?
Oh, the gender wage gap is real. It
Okay.
we need to work aggressively to close it.
Okay.
Right. And
Okay.
so I
Well, we're
mean,
being told it's real. It's nice to validate that, I guess, with this
yeah,
discussion. And are we talking about how much we're getting paid? Like, do people talk about that yet? Or are they still guarded about that? Are they told not to talk about it? Like, how does this all go down?
I think it's still pretty taboo in society, right?
Mm-hmm.
And so I think that because it's taboo, right, people don't like to talk about money. They don't like to talk about it because it's can be perceived in a lot of ways as perhaps rude, or
Mm-hmm.
they don't want to be
Mm-hmm.
perceived as greedy or something like that if they talk about it. But in reality, in my perspective, the less we talk about it, the more people are kept in the dark. The more people are kept in the dark, then they don't know their true value.
Mm-hmm.
They have no basis of comparison, right? And so I tell early career docs, talk to your co-residents, see what they're being offered, right? Leverage each other's group knowledge, right?
Mm-hmm.
To help each other out. Because that knowledge is power, right? And if we don't have that knowledge, then we're kind of stuck.
Mm.
So
Yeah. Agree. I think even in Australia, where we know what we can charge the government per patient in front of us, so it's a fee for service model, but then there's the percentage overhead you're going to pay to the clinic to afford staff and the EMR and the lights on and the paper and the printer and that sort of thing. So it's more widely known amongst our registrars. They're talking about what people are offering in terms of percentages. They're asking for help in the Facebook groups, like, is this a good deal or not? Like it's good to see this banter happening and even the going and learning. How do we bill correctly? What is the right item codes to be using? Because they will underbill
yeah,
typically to keep
all the
themselves
time.
safe to because they don't want to have to they don't want to press in and try some of these other interesting ideas in terms of item numbers, and it's quite fascinating to see how it's almost self-inflicted, the under
Right.
earning
Yeah,
within a fee for service model.
100%.
Yeah. Well, thank you. This has been really excellent. Is there any, where do people find you if they're interested to learn more about your new negotiation offer that you've got into the world?
Yeah, thank you so much. So I'm found in two places. One is at sustainablephysicians.com, and that's predominantly where I offer, for instance, my one-on-one coaching services. And then with Dr. Cynthia Chenjoya, we are at www.physiciancontractnegotiation.com. And we have
There you
an
go.
online program that we call Get Your Worth, contract negotiation for early career physicians. We're not having an active cohort right now, but we will be having a cohort coming up here in the fall of 2025. And then our plan is to continue that yearly and keep it going to provide longitudinal support for people.
Got
So
it. Okay, great. And anything we didn't talk about that you want to make sure to mention?
yeah, I would just say that, for all you doctors out there who are listening to this, thank you for what you do. You matter. What you do is so important. Sometimes we all, don't necessarily feel as valued or appreciated in the roles that we do. So just want to say thank you to everybody out there for what you do because it matters. It's important. And if you're feeling stuck, things can get better. And it's sometimes reach out for support if you need it. Uh, yeah, it can get better.
Beautiful. I love that. Yeah. Don't just stay stuck. Staying stuck is miserable. We don't want miserable for
Yeah,
you. That's
definitely.
not sustainable.
No, it's,
Beautiful. Well, thank you so much, Peter, for this conversation and have a great week, everyone. Bye.
take care.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.